Okay, let's move on. And Dr. Chuck, you being the head team physician with the Chicago White Sox for so long, and I know you've kind of given up those duties now to Dr. Nick Verma, but I want to talk about concussions, and we got a great guest coming on from Midwest Orthopaedics at Rush, the early care of concussion treatment and the importance of that. But did you see a lot of concussions in baseball?
Steve, surprisingly we did. It's not maybe as many as what you see in professional football, but in baseball, it's the home plate collision, the on-base collision. It happened a fair amount. And, certainly our next guest is somebody that we relied on exclusively for many years, as do most of the Major League professional teams here in Chicagoland.
Let's bring on Dr. Elizabeth Pieroth, board-certified clinical neuropsychologist and the new director of the concussion program at Midwest Orthopaedics at Rush. She's been involved in the assessment of players in the NHL since 1997, the head injury concussion specialist for the Chicago Bears, Blackhawks, White Sox, Fire, and the National Women's Soccer League. Dr. Pieroth, how are you this morning?
I'm doing well. Thanks for having me.
Yeah, thanks so much for joining us. Really appreciate it. So what does research tell us about the importance of early intervention for concussion treatment?
Well, there's been a number of studies that have demonstrated that the sooner somebody is evaluated by a clinician who actually specializes in concussion, the sooner they get better. And a study just came out last week out of Pittsburgh that showed interesting results that when somebody is seen by a concussion specialist within a week of their injury versus 2 to 3 weeks, on average, they actually get better about 20 days sooner. And it's a really interesting way to look at it. And the reason for that is that when you see someone who is experiencing concussions, they are able to get you into treatment sooner and really able to understand the types of symptoms that may be a warrant treatment. And so instead of just having a sort of blanket approach of resting, which is not actually what we recommend anymore, we can create individualized treatment plans and actually get people back to their lifestyles, to school, to work, to play sooner.
Elizabeth, that's something that I think I'd like you to expand upon for our listeners, because certainly, 12, 15 years ago when concussion and concussion awareness became much more prevalent, the old treatment was, lock them in a room, close the door, turn off the lights. Why don't you explain to our listeners nowadays how the diagnostics have improved and both the therapeutic interventions?
It's a great question. And I always tell people it's interesting because there was never any scientific support for this notion of sort of putting people in dark rooms. It's just something that sort of developed over time. And it didn't make a lot of sense to us who do this work, that we saw that when you shut people down, they actually were more symptomatic, particularly people who are athletes or just people who are active. It's really difficult for them to suddenly do nothing. And what the research has shown us is that when we move people sooner, when we return them to stimulation sooner, they actually improve. There is physiologic reasons why movement and stimulation actually aids recovery. And that's not to suggest that we overstimulate them or send them right back to their lifestyles and their work and school and all those things, but you really do accommodate for their individual symptoms. And that's really the key issue, is that every concussion is quite different. And you want to do a thorough assessment to understand what in particular are the symptoms that are aggravating that individual. And then you make accommodations in the school, in the workplace, at home to adjust for those symptoms. And you also then get them into treatment sooner. And that's the key, is that, people can be quite miserable while they're waiting for these symptoms to go away. So we want to intervene sooner. And so the buzzwords in concussion management nowadays are really early intervention and active rehab.
Elizabeth, one other question I think that I've had many parents ask me, is there a difference between the approach for diagnosis and treatment in whether it be elementary, junior high, or high school, or collegiate? How would you break that down? And if I'm a parent of a 9 or 10-year-old and my son's a catcher, are they able to get concussions? Is it only a disease of older children or teenagers?
Oh, no. I mean, anyone, any age can get a concussion. People hit their heads in all kinds of ways. And interesting, if you look at the MLB research, about a third of all concussions in MLB are from the catcher. So what Dr. Bush-Joseph said is exactly correct. And so, no, people get concussions from non-sports activities, this time of year, unfortunately, in Chicago, we see a lot of slip and falls on the ice, and we certainly have car accidents and workers' compensation injuries. So it's not just a sports injury, and it's certainly not an age or gender. In fact, the research tells us if you look at sports that both males and females play, we consistently see a higher rate of concussions in sports that in girls. So soccer, basketball, hockey, across the board, you're seeing a higher rate of concussions in girls. So we really have to be aware of the differences in development. So we know that kids take a little bit longer to recover. And we also have a different approach when it comes to return to play for a 10-year-old versus an adult. So that's why it's important that you're working with somebody who understands those differences and is not applying a sort of one-size-fits-all approach to assessment and treatment of these injuries.
Once again, visiting with Dr. Elizabeth Pieroth. I'm Steve Casher with Dr. Charles Bush-Joseph. You're listening to Sports Medicine Weekly on this Saturday morning. Dr. Chuck filling in this week for Dr. Brian Cole. Dr. Pieroth, our guest, is a board-certified clinical neuropsychologist. And what I want to ask you about, the new director of the concussion program at Midwest Orthopaedics at Rush. So, Dr. Pieroth, what is MOR Rush doing differently to address concussion symptoms earlier on?
I'm thrilled to be working with at MOR and Rush because they're a very forward-thinking organization, and we have been able to implement a couple of things that I wanted to do for a long time, and one of them is doing exertional therapy. What we see is that the sooner, again, like I said, the sooner we move people. So we are starting athletes in particular on a what I call therapeutic exertion because that shows that they improve. We also have new technology. We are the first hospital system in the Midwest to have a product called iBox, which actually tests ocular movement. There's been a real explosion in the last couple of years demonstrating ocular changes post-concussion, that the eyes really tell us a lot about concussion. And if we can pick up these ocular changes sooner in an objective way, something that we can actually measure, we can determine which patients would benefit from ocular treatment sooner. We can make adjustments in the school and work place that are more appropriate for that person's individual differences. So it's brand new technology. There's only about 5 or 6 hospital systems in the country that will have this new technology. So I'm thrilled to be offering it at MOR.
You know, Elizabeth, I think you've assembled a great team between the physicians at Rush and Midwest Orthopaedics at Rush, and I think you will have a great service to offer, parents and athletes in the Chicagoland area. And just one last point, I think that does warrant follow-up. I think parents get fearful that treatment for concussions may involve medications or invasive treatments requiring injections or surgery. Is that the case? Or can you just provide a little bit of overview of the types of therapeutics beyond some of these technologies you just discussed?
And that's a great question because truthfully, the research demonstrates to us that not a lot of people actually need medication. Unfortunately, there are some people who have persistent headaches that we will send to neurology for medication consideration. But most of the treatments for concussion involve physical therapy. Physical therapy is really a key player in this concussion treatment. So we send a lot of people to treatment, to physical therapy for treatment of the neck. When somebody hits their head, there's always some involvement of the cervical spine. So we see a lot of symptoms that are actually being caused by an underlying cervical injury, a neck injury. So that's really important. We see underlying jaw injuries. We see a lot of vestibular therapy, and that is sending people to specialized physical therapists who work with people who have balance disturbance, oculomotor changes. So there's a lot of evidence-based treatment that really helps. And so we want people to understand that this shouldn't be a passive injury, that you don't have to sort of wait around and hope it goes away, that there are things that can be done to aid recovery, to limit those symptoms, and actually get people back to their activities.
Dr. Elizabeth Pieroth, thanks so much for joining us here on Sports Medicine Weekly.
Thanks. Appreciate the conversation.
Elizabeth, thank you for your time.
All right. Pleasure. Have a good night.
That's Dr. Elizabeth Pieroth, again, the co-director of the NFL Neuropsychology Consulting Program, also the assessment of players in the, let me start that again, Sorry, guys. 3, 2, 1. And that was Dr. Elizabeth Pieroth. She has not only been involved with the assessment of players in the NHL, also the head injury concussion specialist for the Bears, Blackhawks, White Sox Fire, and the National Women's Soccer League, but also the co-director of the NFL Neuropsychology Consulting Program. We're going to take a break here on Sports Medicine Weekly. When we return, it's our Ask the Doctor segment. So stay with us. You're listening to Sports Medicine Weekly only on 670 The Score.